discuss is the importance of how to use an EpiPen properly. Why do you use an EpiPen? If someone has what's known as anaphylaxis, they are having an allergic reaction that sometimes can be life-threatening, and they may have to use an EpiPen. So it's very important that you know how to use an EpiPen if you should, come into a situation where that should occur. Why do you need an EpiPen? Most often, allergies are usually due to food, drugs, or insects, or insect venom. Here are some causes that you may see people that are often allergic to that require EpiPens: peanut butter, aspirin, latex, bee stings, penicillin. Some symptoms may include hives, difficulty breathing, wheezing. Treatment is often for anaphylaxis the EpiPen is used. You need to make sure that you know how to use this before you ever attempt to do it, okay? The first thing that you want to do is you always want to make sure that the medication has not expired. You need to keep this at room temperature. If you come across someone who's having an anaphylactic shock, if they're able to talk to you, ask them if you can help them. Cover yourself. Today we live in a society where people love to sue, so make sure you ask them if it's okay to administer their EpiPen for them, okay? This is how you administer an EpiPen. You're going to remove the gray cap. You're going to hold the pen with the fist, okay? You want to inject this in the mid part of the outer thigh. You want to make sure that's where you're injecting this medication, because if this should be injected into a vein, it can cause death. So you want to make sure that before you inject this, you do not have your finger by the black tip, because if you was to inject this into your finger, you're going to get some epinephrine. So that's not good. So what you need to do, hold it firmly, make a jabbing motion, jab. You will hear the pen click. Hold that in place for 10 seconds. After your 10 seconds is up, you want to remove the EpiPen the way you inserted it, straight out. You will rub the area for 10 seconds, okay? You want to make sure that you send this with the patient through the EMS system, okay? I'm not sure, I think I said that the patient, make sure they're sitting. If not, you need to make sure the patient's in a sitting position. Is there any questions on how to use the EpiPen? What I'm going to do now is I'm going to ask someone to come up and demonstrate for me exactly how to use an EpiPen. Okay? Janet, could you please come up here and show us how you do this?
Sure.
This is Janet. I'm returning the demonstration on how to use an EpiPen. Remove the gray cap. Lift up, jab in the outer thigh for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. Remove the same way in an outer motion. And send this with the people. And I did forget, I'm supposed to rub the area for 10 seconds, but we're going to do that right now. So I'm rubbing. I guess that's it.
Do you have any questions about the EpiPen, Janet?
Well, what if I was out and say I did see someone in distress and, I asked them if I can, help them or administer the EpiPen and they say no and they refuse, what should I do?
Well, to cover yourself, if somebody is alert and coherent and they tell you no, then you would not want to assist them, because legally, if they are within sound mind and you inject that pen, they could probably sue you. So
Just call 911 and be done.
Just call 911.
Stay with them maybe.
But I can't foresee someone being in distress and not wanting help, but it probably does occur. So if somebody is in their right sound mind and they tell you no, then I would not inject.
Okay.
Do you have any other questions?
Nope.
Do you understand how to use the EpiPen?
Yes.
Okay, well, thank you.